Don't worry, it's not my tongue, it's a balloon. Right, I want to do a little bit more talking about those fizzy feelings. So, what happens when we start feeling those fizzy feelings? Well, I want you to pretend that inside you, you've got two balloons and you're going to blow them up. So you need lots of air to blow up these balloons. Now, if I could blow up this balloon to show you, then I would do that. But this is what happens when I try and blow up balloons. I can't do it. So we're just going to pretend that inside of us, we've got balloons and we're going to suck in the air. Did you see how my chest went up? Because my lungs, my balloons got filled with air. It might be that you want to put your hands a little bit lower on your tummy and see if you can make that feel like a balloon. Can you do that and make the balloon just one balloon and do it down low? And what we're going to do when we blow out, we're going to have, I'm not going to light these candles because I don't want to be dangerous lighting things, because it's not safe for me to do that. So I'm just going to pretend 6, 7. I've got a number 7 that might look backwards. If I turn it this way, it'd be okay to you. So I'm going to have a candle, but I'm going to move it quite far away. So I'm going to blow up my balloon at the bottom of my tummy. And then I'm going to use that air to blow out my candle, but my candle's a bit far away. So I'm going to do that quite slowly. I'm going to try again quite slowly. Are you practicing that with me? Now sometimes that's an easier thing to do because we might be at home or somewhere that we don't mind doing it. But sometimes we might be at school or with friends and we can just do it, but we don't need to pretend or think that we've got a candle or balloon out in front of us. We can have it in our head, like thinking about it. So I'm going to pretend that I'm at school. I'm feeling a bit irritated. So I'm just going to breathe quite calmly, or I can do it more exaggerated, a bigger movement if I wanted to. And I can do that in different places. And it just helps when you start feeling those tingles or that knot or the bit irritated, that we start practicing that breathing in like a balloon. You're blowing up a balloon and push your breath out like you're blowing out the candle, and see if that helps. But for different people are going to find different things useful at this time. So you might want to pause the video in a second, or freeze on a silly pose, and think about whoever you're with, or maybe you're by yourself watching this. Think about ways that could help you when those fizzies start. So I really like colouring in, so I might want to get a colouring book and do some colouring. It might be that you're somebody that likes moving about, so it would really help you at those times if you went for a walk around or did some exercise of some sort. It might be that you like fidget toys. I've got quite a few here. So it might be that Play-Doh or something you could squeeze and poke. It might be a bouncy ball if you're allowed it wherever you are. Obviously we don't want a really small one to be bopping around the classroom, but we've got to see what works. It might be that you just need something in your pocket to twiddle, and it doesn't have to be a toy like this. It can just be maybe a stone or something that you feel that you want to fidget with. Grown-ups do it with pens, and they'll stand there. Maybe somebody you're with's got a pen now, they're twiddling. But grown-ups like moving around their fingers with their phones, their pens, different things, and the same as we can all do it. Find something to fidget with. So maybe it's just a time that you've done your breathing, you've tried that, you want to try something to fidget with, or you want to do some exercise, or you want to do some colouring, or you want to have a teddy wherever you are, or a soft toy that you like that you can keep safe, whether it's at school or at home, and you just think, right, I really need to feel a big cuddle right now. I don't want it off anybody around me right now. Maybe you do, or maybe you don't, or maybe it's different at different times, but a teddy or something that you like, a soft toy, might be something nice to have. The other thing you could do is create a bit of a space, a calm space. So where would be nice? Maybe it's at home, maybe you've got your own bedroom, maybe you've got a quiet space somewhere in your house that you could create a quiet place where you could have a pillow and a soft toy, or the activity that you like doing to keep you nice and calm, or to help you feel calm. And where could you do that when you're at school? Is there a room? Is there a book corner? Is there somewhere that you could go to when you start feeling these fizzy feelings? Because what we don't want is you to not have that chance to breathe or to relax and to feel calm, and then that bottle of Fizzy Bop just starts shaking everywhere, and it's really, really hard to stop the bubbles going everywhere. I was thinking about shaking it up and taking the lid off, but I think I might make a mess, and I don't think my cat will like having their spray everywhere. But you can imagine if I shook and shook and shook and took that lid off, and then I said, right, let's go and cuddle a toy. It's quite hard to calm down, isn't it? But if we could start to practice when those little bubbles are building up inside of us, and then maybe we can slow down so we don't get so many bubbles. And sometimes we will get those big bubbles, and that's okay too. But we've just got to work out what's the best way to manage them. So going for a walk, going for a run, cuddling our toys, doing our colouring, maybe watching something, or having some screen time if we need a distraction, and it depends where you are. Maybe that you've recognised that you're actually hungry, or maybe you've recognised that you're thirsty, and it's just recognising what you need right now to help you feel a bit better. Anyway, I'm starting to get ants in my pants. Cat, I got a bit distracted then. There you go, this is my cat. His name's Blue, and he's got big blue eyes. But yeah, you keep thinking of different ways that might help you, and I will leave you until next time, and we can think of some other things that we could do together. Okay, bye bye.